SANGMÉLIMA in the south region of Cameroon will soon become a reference in technological training in the higher education sector. This is the desire of the people and the administrative officials who are glad that their town is hosting part of the Cameroon-Congo Interstate University.
We are waiting for the ministry to open the school, the university, so that all the youth, not only here in Congo, in Gabon, and the other regions of the country, can be concerned with that big infrastructure.
Since his creation, SANGMÉLIMA was Silicon Valley of Cameroon because of his very good result in exams in Cameroon. So when the head of state is creating this infrastructure, we are very glad to receive them here.
Construction work on the main building of the SANGMÉLIMA campus is complete. The officials are now in another phase, that of preparing for the 2018-2019 school year. They have begun purchasing materials for the various offices, computer library and amphitheater.
We are very confident that the first school of this university will soon begin here in SANGMÉLIMA. And I also want to inform the public that this university is not a traditional university, but it is a technological university with 4 domains of study. Here in SANGMÉLIMA, we will have agriculture and ICT. And in Weso, in the Congo, we will have agroforestry and applied science.
The Advanced School of Digital Engineering is the first scheduled to open at the Interstate University in SANGMÉLIMA.
We will have 3 programs. The first one will be digital design. For example, when you look at a cartoon on TV, when your child play electronic games, this is digital design, you understand? And this program is open for all the majors. You can major in humanities, you can major in social science, you can major in science, you can even come from technical education. The second program will be information and communication system. For example, you see today the impact of social medias. You also know that all the society is digitalized. So we must have experts which can pilot the digitalization of the society. And the third program, which is more technological oriented, will be computer engineering and digital system, telecommunication, computer science, computer security, and so forth.
Entry is through a competitive examination, though best students of secondary schools with A grades could gain direct admission into the school.
We want this university to have a standard above the national universities. But you also know that in our context, sometimes a lot of people think that if we do things which are very elitist, it is not in conformity with our national environment. But we will try to have higher standards. Our country, and I think it is the same for most of the African countries, they want to be industrialized. And if we want to industrialize our countries, we need to train a lot of experts in technology field. We want the city of SANGMÉLIMA to become one of the major industrial center for ICT development in Cameroon. Our dream is that a lot of students who will be graduated here in SANGMÉLIMA stay and live here in SANGMÉLIMA to design startup, to implement startup here, so that maybe in 20 years, 30 years, SANGMÉLIMA will become a digital industrial center of Cameroon.
The Interstate University with seat in Weso was created a couple of years ago to strengthen sub-regional integration and provide the sub-region with an internationally recognized university of excellence in technology.
This university is not a Cameroonian state university, but it is owned by the Republic of Cameroon and the Republic of Congo, which means that everything which is done by one of the country must have the approval of the other country. So everything which is we are doing here in SANGMÉLIMA has the approval of the Republic of Congo.
Students of the school who will come from Cameroon, Congo, and other countries in the sub-region will, upon completion of training, graduate with a degree in engineering.
The difficulty comes from the fact that it is not a Cameroonian state university. It is not a Congolese state university, but it is a new kind of university, which means that this you must conceive everything from scratch. You must conceive everything from scratch. In our environment, we don't have yet a technological university. We don't have yet an international universities. So there is a lot of things to do. And all these things must be done by Cameroon and Congo.
Away from higher education to health, SANGMÉLIMA is also benefiting from quality services provided by the referral hospital that opened its doors in 2014.
Having a reference hospital in SANGMÉLIMA is really something interesting. It's an initiative that's so good because generally the standards have been that people do take their patients here for one or two type of pathologies. They have to travel kilometers to go to Yaoundé, maybe Douala, so as to have maybe diagnostic laboratory investigations, or maybe to find some particular medications before they could be attended to.
It is a Category 2 hospital that receives patients from other hospitals in the entire region and even from the sub-region.
The health structure, described as an architectural jewel, has up-to-date technical plateau that responds to the needs of the population in terms of surgery, gynecology, general medicine, pediatrics, among others.
It has the required number of specialists. That is, in fact, there are quite a good number of them. It has the equipment necessary for the care of any kind of pathology that we commonly find here and maybe which are a bit rare. We have machines here which we can find only maybe in Yaoundé or maybe abroad. For example, a liver bank.
The hospital has a modern laboratory, X-ray department with sophisticated equipment, and 4 operation rooms where about 20 surgeries are performed monthly.
Despite the splendor of the building and the quality of services provided, the cost here is relatively moderate compared to other hospitals of the same level.
Affordability is with respect to the context. Somebody treated for cancer would find a treatment of maybe 2 to 3 million francs affordable for him. But somebody with a common problem like malaria or common cold will not find 3 million something easy to mention.
With 115 beds, about 20 medical doctors, and more than 50 nurses, the SANGMÉLIMA Referral Hospital also has a well-stocked pharmacy and an emergency unit modeled to suit its name.
The patients are not always able to pay for their bills, for their services. That is, we have to bend ourselves to the common patient to the pocket of that patient, so as to frame something that will suit the patient.
In the past, we faced so many difficulties in the pharmacy, but now we have many drugs in the pharmacy. We can take charge of many diseases.
The joy of the people is that they no longer have to travel out of the region for emergency cases or serious health complications.
L'hôpital de référence nous a baissé le prix par rapport avant.
Prices have reduced with the coming of the referral hospital. Before, delivery was expensive, echography too. We no longer need to go to Yaoundé to treat complicated cases.
Pour soigner les cas difficiles.
They are really appreciating the cost of the treatment. Some of them are even saying that the drugs here are really affordable in comparison with the pharmacy in the town.
As they look forward to enjoy all the benefits that come with having such structures of high standards in their town, the municipal and administrative authorities are also bracing up for a subsequent population increase.
We are here at least to secure the population first of all, and you know that when the population grows like that, we have to put in place new strategies to give them the frame that can able them to go to school without any hitch. So we are used to those kind of things. I was in Kumba where I had the HTTTC, and I know how to manage it when they will be around.
These achievements are among many others by the state put in place with the goal of serving the people and speeding up development.